Okay, ladies and gentlemen, you are welcome. So in this video, we are going to look at the concept of stomach structure and it is blood supply. Don't forget to subscribe and join my YouTube community. Introduction. The stomach is a muscular and hollow organ that is located at the upper abdomen. So first, we should understand that when stomach it is empty, it has a G shape and it is a muscular hollow organ that is located at the upper abdomen. So you see the first thing that we need to actually know the location of the stomach. So it is located at the upper abdomen and it is muscular and also a hollow organ. And also more importantly, when the stomach is empty, so it has a G shape. And very importantly, stomach it play a crucial role in digestion. So it is very important in digestion by storing, mixing, and breaking down food. So you should understand that the major role of stomach is digestion. And what does it do in the digestion is by storing, mixing, and breaking down of food. And its structure is highly specialized to facilitate these functions effectively. It means that the structure of the stomach, it is very important in its specialization to facilitate the digestion of the food material. So now the next thing is the external anatomy of the stomach. So the stomach is mainly or is made up of four main parts. In the stomach, it has four main parts. These four main parts include cardia, that is number one, fundus, body, and pylorus. So as we can see it from here, this is the cardia, this is the pylorus, this is the body, and this is the fundus. So these are the four main parts of the stomach. So you can draw the structure of the stomach. It is very important. So if you ask a question on the anatomy of the stomach, so when you explain what it is, so it is very important to also show it as diagrammatical presentation. So it has cardia, fundus, body, and pylorus. And this stomach, it is positioned obliquely in the left upper quadrant of the abdomen. So that is the specific location and the position of the stomach. That is the left upper quadrant of the abdomen. Its external surface shows curvatures, which is known as a greater and the lesser curvatures. So this is actually the most important thing that we need to know. It's muscular and hollow organs. It is very important in digestion by storing, mixing, and food substances, and it's made up of four major fats: cardia, fundus, body, and pylorus, and it is positioned at the left upper quadrant of the stomach. And then also the internal structure of the stomach is made up of four layers. So there are primarily four layers of the stomach, which include mucosa, submucosa, muscularis, porphyria, and serosa. These are the layers, the primarily layers of the stomach. And as we can see them, the four major fats or the four primarily major fat include mucosa, submucosa, muscularis, and then serosa. These are the layers of the stomach. And the importance of the stomach, it contains a gastric gland. And this gastric gland in the mucosa secretes digestive enzymes and the acids. Digestive enzymes in the stomach include renin and pepsin. And of course, the acid is HCl. And of course, the muscularis layer, it has three muscles layers that aid in howling and mixing food. As we can see, the muscularis, this is the muscularis where we have oblique layer, circular layer, and then longitudinal layer. So it's made up of three muscles layer. And the major importance of muscularis is howling and mixing food. So this is actually the structure of the stomach. So I think very importantly, ladies and gentlemen, if you are to answer the question related to the structure of the stomach, the first thing you need to describe the structure of the stomach, the functions of the stomach, and then the external layers where it has four main parts, and then the layers and also its position. So if you can do that and also draw this diagram, I think you are done with that. So very importantly, then the blood supply to the stomach, how the blood is supplied to the stomach. So the first thing that we are going to look at is the arterial sources. So the main arteries that supply the stomach are left and right gastric arteries. So we have left and right gastric arteries and also the left and right gastromental arteries. So these are the four arteries that supply blood to the stomach from the heart. And very importantly, the left gastric artery, it arises from the celiac trunk and supplies the lesser curvature. Remember, if you could remember, ladies and gentlemen, we talk about the issue of the greater and the lesser curvature. So it is external surface show a curvature. So the curvatures, the external surface of the stomach, it made of a curvatures. And these curvatures, we have a greater curvatures and a lesser curvature. So in terms of the blood supply, if you can see it clearly, we can see that the left gastric artery, it actually comes from the celiac trunk and it supplies blood to the lesser curvature. So it means that it is the role of the left gastric artery to supply blood to the lesser curvature. And then very, very importantly, the right gastric artery usually branches from the common hepatic artery. So it means that the right gastric artery, it arises from hepatic artery, and the more important of this right gastric. So it means that both the right gastric and the left gastric artery are important in supplying blood to the lesser curvature, you see, to the lesser curvature. Of course, as you can see, this is the celiac trunk. And you can see this is the celiac trunk. And of course, the left gastric, this is the left gastric. As we can see from here, it arises or it came from the celiac trunk. And then we can see where is they are actually from this diagram. Then we can also see that the right gastric artery, it actually comes from hepatic artery. From hepatic artery. So where is the right gastric? So this is the right gastric. So the right gastric artery, it came from hepatic artery. So that is the most important thing. And it supplies also blood to the lesser curvature. Okay, and then the next thing is actually the blood supply to the stomach also in the case of venous drainage. So of course, when we said venous blood, it means the oxygenated blood. So the oxygenated from the stomach drains primarily into the portal vein system. And of course, the gastric veins drain directly into the portal vein and following the arterial supply. So this venous drainage, it plays a vital role in liver function and metabolic regulation. So this is actually how the blood is supplied to the stomach. So we have venous blood, which actually drains primarily into the portal vein system. And then, of course, we have gastric veins, which drain directly into the portal vein following the arterial supply. So then the next thing is the summary and clinical relevance. So the stomach structure and blood supply are essential for its digestive functions and overall health. So variations in blood supply can influence susceptibility to conditions like gastric ulcers and ischemia. Therefore, understanding these anatomical details aid in surgical procedures and diagnosis of gastrointestinal disease. So, ladies and gentlemen, this is where we are going to stop. And in this video, we are able to see the internal external structure of the stomach, as well as the sources of the arteries, as well as their blood supply. So thank you very much, ladies and gentlemen. I hope this is the first time. I hope if this is the first time you come to this YouTube channel, don't forget to subscribe and join to my YouTube community. See you next.